I'm delighted that Dr. Kshama Metre has won this award because her work is having a real long-lasting impact. Dr. Metre could have gone to rural India and worked and served the communities very effectively as a doctor, but she didn't do that. She saw how health issues are interrelated with so many other things like gender issues and education, and how all of these things cannot be tackled in isolation. She's come up with a model that can be replicated elsewhere and that is being replicated elsewhere and has successfully helped thousands of women and men lift themselves out of poverty. The thing that makes Dr. Kshama Metre and her approach to development so unique is the integrated approach that she takes to development that is born out of her own experience of living and witnessing the issues affecting rural India firsthand.
Our unique approach, if ever I could talk about a legacy, is in the belief that the people themselves are the most important actors in change, any change that you want. So it's about active participation by the people themselves. Children, youth, including adolescent girls, men's groups, women's groups, when they come together and look at the issues of their own group as well as that in the community, I think there is some energy that comes to play which even I couldn't imagine. I'm a doctor. I came in very close association with the villagers and realized with them as we sort of talked that their life has so many struggles, and if I were to work only with health, we were not even touching the tip of the iceberg. We have to work on poverty, we have to work on livelihood, we'll have to work on social justice, we'll have to work on gender, health, education, and into governance, local self-governance, before things begin to change. But we realized that there were so many things that they could change themselves. The women are definitely the core of our program because it's the woman in rural India who holds the whole family together. If they can manage a home, a woman can definitely manage a little village very well. But she doesn't know that she's so important. I tell the women that if you all went on a holiday for a day, what will happen to India? Suppose you went on a holiday, you think you don't know anything? That's how you realize that you are definitely, women are definitely contributing to the economy. They have their rights. And I think it's the empowerment of the women and the control and management that they're taking over gradually will bring them more rights than laws that bring rights of women. So the process of getting the women involved in the program was the change in the attitude of the women themselves about themselves, change in the attitude of the men who thought women were doing nothing, because when they saw that women were getting very empowered with the microcredit accessibility through self-help groups, it was the women who started helping the men and folk by taking credit without any collaterals. That's how self-help groups work. Governments and bigger donors used to sort of say, no, this is not the way development happens. How? I can give you money only for health, and even in health I can give you specifically for one little block. But as you see development today with the people, more and more organizations and institutes are realizing this approach. I believe, with our experience, that this is how we should be able to transform rural India. I'm very optimistic about it.